Good evening, good evening, good evening. Okay, what time is it? It is 5:58. Everything is set up on the Zoom is live. The hair is hairing a little bit, and the YouTube is live. Hey, hey, hey. Jana Anna, how are you doing?
Leslie.
What's up?
Hey, how you doing?
Doing good.
How are you?
I'm good, I'm good, I'm good. I'm good. I am so ready. Um, you know, to have this particular live. I'm sorry, I'm texting idiots and it's very difficult. It's very difficult. I really, it annoys me to have to dumb down my language to say things that I believe I've already said simply.
Mm. That
You
is
know?
understood.
So when I say no and someone says, why not? It makes me want to gnash my teeth to powder.
Ultra powder. Oh boy.
Oh my goodness.
You never heard that.
That's a lot of gnashing.
So anyway, okay.
We're gonna mute ourselves unless you need us, and then we'll unmute. Okay.
Okay. Okay. And here's Coco. Yay. Jana, say hello. How are you doing? Welcome in.
Hello, everybody. I'm I'm actually eating my dinner, but when you're ready, I do have a question, but no hurry.
Okay, no worries.
So I'm going to mute while I eat until you're ready for me.
That's perfectly fine. That's perfectly fine. Coco, unmute yourself and just say hey and let me know. You might still be at work though.
Hey, hey, I'm here, still in the office.
Okay. Okay. We're just gonna wait for people to come on in. It's Tuesday night. Is it already Tuesday? Oh my gosh. I guess it is. Yesterday was Monday.
It was a busy day. It feels like a Wednesday.
Today,
Yeah,
yeah, no, yesterday and today have been quite busy. And my granddaughter had a night terror last night. She's fully asleep and she's screaming her head off. And I'm on live and I'm calling my daughter and I'm like, you gotta go get her. Like, what's going on? And she goes up and calms her down and he gets everything settled. 2 hours later, again, just, I'm like, oh my gosh. And I said, don't put her in her room again by herself. Like, I don't know what's happening there. And she did. She was like, I'm gonna put her back in her room. I think she'll be fine. And then an hour later, she went off again. And then I was like, just let her sleep with me. Like, just put her in my room so that we can get some sleep. And she slept in bed with me and she slept horizontal the whole night with her
oh,
feet in my mouth.
no,
I was like,
I,
whatever, as long as she's not screaming, like as long as that's not happening, I don't even care.
right. I remember last night when you stated, why is she screaming?
Yes.
Oh, poor baby.
Okay.
Mhm. Leslie, she might be tapped in. You never know. You never know what children
No, I
be.
know. I told my
Mm-hmm.
daughter, I said, I already think she's uh not clairvoyant, but what's the word? I can't think of the word. I'll think of it in a little bit and it'll just come blurting out to say the least.
Mm-hmm.
Uh but I think she's very connected to, the spirit realm.
Mm-hmm. Gifted. Yeah, I
Yeah.
remember when I was 8 years old. And this was going to I-75 South here in Atlanta. Me, my mom, and my stepfather and the rest of the siblings. We was in the car, and then I remember like yesterday, all of a sudden I was like, we gotta get off, we gotta get off, we gotta get off, we gotta get off. And it's like, what are you talking about, Jeannie? Well, my mom called me, Jeannie, what are you talking? I said, we gotta get off. And I just know I went in a panic and I started kicking the seat purposely, just kicking to make them get off on the side. Next thing you know, bam, 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 bam. It was all in the news. It was a 10 car
Really?
pileup.
Wow.
10 car pileup. It was all I remember, like it was all in the news. It was all on 2, 5, and 11. And we were in the midst
Wow.
of it. And if we would have stayed there, we would have been car number 2.
Wow.
hmm So that's why I said, yeah, she might be tapped in. Different thing, yeah. And Nana is the safe. What is your nickname? Mimi, Nana,
Mimi. Yeah, Mimi.
Mimi. Yeah, Mimi is the safe haven. So that's why she slept good.
Yeah, no, I was just like we talked for about 10 minutes and she finally, settled down and laid on my chest and just relaxed and then she turned herself all the way around and put her feet in my face and fell
Oh,
asleep.
that's so precious.
Hello, ladies.
Hey, Altamise, how are you doing?
I'm here. How are you all?
Alive and well, alive and well.
Mm.
Great, great. I need to talk about my eyes.
Let's talk about your eyes.
Well, as you know, I told you what seeing I was doing has diminished quite suddenly. I shouldn't say suddenly. I woke up Saturday and it was not any better. So I rested from any drops. I didn't do anything. And I'm barely seeing. So today I did 30/70. Um I think by forcing the not forcing, but by continuing to use the foreign eye, that I caused inflammation. So this my left eye was just really, really, really running. My right not as much, but running, and they had dried before. So I figured I'd just give them a break and see if that was it. So I'm really thinking it must have been some inflammation or something. So I don't know what to do now, and I'm stumbling around in the house, and it's so disheartening because I was seeing and now I'm not. So I don't know where to go now.
Okay. So we're gonna actually work this situation because it often happens um that the sight gets worse before it gets better. The draining of the eye, I don't believe that that's inflammation per se, but I do believe that the eye is draining trash, that you've got a clog going on somewhere in removing debris, the waste from the eye system.
Okay.
That waste buildup can cause the eyesight to actually go dimmer for a period of time, and then it'll slowly come back lighter. But we need to figure out what's happening with the eye and which drops are going to provide the benefit. Do you have the 40/60?
Yes, and that was all I was using at first because I didn't have the foreign eye or anything. So I had been
Right.
using the 40/60 first. And let me add one other thing. Also, around that same time, um I woke up one night and I had mentioned to you once they talk about a bleed in the back of the eye.
Yes.
It looked like a long floater, but it wasn't a floater. It was actually looked more like the gel kind of stuff and
Okay.
stretchy. Anyway, but I think it's what the doctor would call a bleed. So that happened. Um, and that didn't interfere with the eyesight much. It was, I think, like I said, I thought it was the inflammation. But anyway,
So what I would like to do, and you're using the Revitalize, right?
yes, yes.
Okay. And so I'm going to go through some questions. Do your eyes, do you feel pressure in your eyes? Can you feel it in from the eye, not from your hands, but from the eye standpoint, do you feel pressure, build up of fluid?
In my left eye, I felt like I would call it an ache. So I don't know if it was pressure. It was just like if I touch the front of my eye, I can feel, you know how you just feel your eyeball, but then it was like a ache behind it. And when I pressed on my right eye, not the same feel.
Okay.
But
Is that
I can't tell about pressure. I'll put it that way.
so pressure would feel like a low level headache, but
Mm.
specifically behind the eye.
So that would be like an ache.
Yeah, but specifically behind the eye. So like your eyes right here and right back here, there's this pressure and there's an
Okay,
ache.
and that was kind of what I was saying after I do the four and I, that I would get that feeling. I was saying, look like my eyeball is aching through the back of my head.
Right. So, and that would make sense if there is a fluid buildup because the foreign eye is going to be, it's anti-inflammatory. So the castor oil and DMSO are going to be trying to pull that fluid out, push that fluid out. But you should get the same response from 3070 and 4060. Not as intense with the 3070, but the same level of intensity with the 4060.
Okay, well, with the 4060, I really don't feel anything. The fluid comes out, but I'm not feeling anything like pressure.
Okay. But you get more drainage with the 4060.
Yes, yes. Even if I'm not using anything all day, it's draining, draining, draining
So does it drain all day or is it draining just for a period of time after using the 4060?
all day.
Okay. And you're still having that experience today.
Yes, yes. And the
Okay.
last time I used drops was probably an hour and a half ago, and it's, I can't even see you good because, what little bitty that I could kind of determine is gone because of the fluid in my eye. I'm having to keep, wiping.
Wiping the eye.
Hmm.
And are you still sun gazing?
Oh, yes. Yes. In fact,
Okay.
I've been sitting out in the sun a lot longer, even during the day.
Right. And do you have any photophobia? So do you have any light sensitivity?
A lot of it. Even looking at the screen right now, it's kind of hurting, and it never did before. And I say hurting, that's the wrong word. It's the light is kind of sensitive. My eyes are sensitive to the light coming from the screen.
Okay. So, do you have a dynamic keyboard where you can turn the lights down and you
Yes, oh
can
yes, yes,
all
yes.
right, so let's lower. Are you, is somebody there that can help you, or can you do that?
Yeah, I've lowered them. Mm-hmm.
Okay, so if you lower it all the way down to where
Uh-huh.
there's hardly any image
Right.
and just sit back, does that screen bother you at all?
No.
All right, so now let's ramp it up. Let's bring it up like a quarter of the way. So
Okay.
it's still dim, but
Yeah.
you see more of the image.
Yes.
So
And
does that bother your eyes at all?
I can't just look at it because, I have to blink, whereas before I could just look. So
Yes.
I would say it's just slightly bothersome.
Okay, so now let's bring it up to like normal brightness.
And I don't want to say it hurts, but yes, I can't really just look at
Okay,
it
so
because it's too bright.
how does it actually feel? And is it just the light is challenging for your eyes, or do you actually have a feeling?
The light is challenging for my eyes. because it
Okay.
makes me want to blink, and not look to see what I'm looking at.
So, and can you cover one eye and see if one eye is less
Okay, my right eye.
intense than the other?
Okay, now let me look with my left eye.
Now, when you change, close both eyes and then open the opposite eye.
I want to say the eye that is running more water, more fluid, is a little bit more sensitive than the other.
Okay. So what I want you to do is cover that eye. Let's cover it for like 3 minutes. Hey Siri, set timer for 3 minutes. And I don't want you to stare at the screen, but have the screen in your space, look
Mm-hmm.
past it, look above it, look below it, look side to side. Don't just
Mm-hmm.
stare at it, but
Mm-hmm.
don't look away from it.
Okay. I'm still doing it, but when I went outside today just to get some air, and my son was washing his car, and it's white, and I just could not look at it in the sun. And of course I couldn't see anything going out there.
So you couldn't look at the car, but you could see the car.
I couldn't see the car because it went away into everything, and that's the eyesight piece of it. But when I opened and opened and opened it, it was just all white. The light and everything was just white.
So the whole background of
Yeah, yeah, because of the
looking at
sun. I'm still looking around.
that's good. Just, and try as be as normal and natural as you would be regardless of, you know, doing this exercise. Do you spend a lot of time with your phone?
My phone,
Yeah.
no, because the last week I haven't been able to see anything on it. Anything I want now, I'm having to ask someone.
Okay.
I was able to read, but not. And typically, no, I don't spend a lot of time on the phone. Okay, what am I doing now? Is that not 3 minutes?
Yeah, that's been 3 minutes. I don't know where my timer is.
I don't want to take up your time
It's
like
okay.
that.
This is why I'm doing this. Close both eyes, but before you take your hand away, close both eyes.
Okay, close them.
Now, I just want you to marinate in the light with both eyes closed for a minute.
Okay.
And now blink your eyes open.
Okay.
Do you have the same level of that, that feeling of the different intensity left eye to right eye?
Yeah, I really can't feel any difference. I think what's messing me up is because I'm not, I don't want to say I can't. I'm not seeing, and I think that's foremost in my mind and in my brain. And that's what my brain is picking up. Don't see, don't see.
Right. And yeah, and what I'm trying to get you to identify with is how your eyes are actually feeling so we can get to the operation of the eye system. And then the sight comes last. You got to get it's got to be working properly before you can actually use it properly.
Okay, what was the question again then?
So I wanted to know if after opening both eyes together, you had the same feeling of intensity as you had before we did that 3 minute, block the eye for 3 minutes. And then when you brought light back into the eyes senses, if you had that same feeling of pressure
Or sensitivity
or
that I'm
sensitivity,
saying.
yes.
I would say it's about the same, less if I had to choose.
A little less if you had to choose.
Mm-hmm.
Do you have your eye mask?
Yes.
Is there a chance somebody could bring it to you?
Oh yeah, I have it right here. I
Oh,
keep it near.
okay. I want you to put that eye mask on. I'm going to set a timer for another 5 minutes and I just want you to hang out.
Okay, and you're gonna go ahead and talk to people, right?
Yes.
Okay. All right then. I'm doing that now.
Hey Siri, set timer for 5 minutes.
Okay.
Actually. Hey Siri, set alarm for 5 minutes. Okay. All right. Nancy, how
Hey
you doing,
there.
darling?
I'm good. I've missed you guys.
We've been here.
I know, I know. Well, you got my text, you know what's going on. But real quick to Ultimates, um, do you have an iPhone?
No, I don't.
Oh, okay. Because I was going to say when you said you couldn't see the screen, I thought you could go into settings and then accessibility and turn on voiceover, and it'll read everything on the screen to you.
I hate that. I can do
I love it. That's the only way I can use an iPhone.
God forbid anything help me.
thank you. Thank you. But yeah,
It's okay. It's okay. Just disregard. It's
Do
all
you
right.
hate do you hate the technology or do you hate what it means?
I hate what it means, I think, more than the technology.
It took
Okay.
me a while to get over that too. It does take time. It does.
Yeah.
But the
And I
faster you get over it, the easier your life gets.
No, 100%. I
Yeah.
mean, I still love it. Like I
Yeah.
love it.
Yes.
Except for when it tells me stuff that makes no sense. Like when it's reading a text and I'm like,
Uh-huh.
I don't even know what that's supposed to say.
I agree. I agree. No, but I didn't have any questions for tonight. I just wanted to come and listen and learn and and just hear y'all's voices. I just like I said, I've missed y'all. I really have.
Back at you.
Yeah, yeah,
Yeah,
too.
I agree. I miss everyone too.
yeah, yeah.
You look a little tan though. You've been out in the sun?
Not a lot. I mean, a little bit. Yeah, a little bit. But I noticed that like when I do the eye drops yesterday morning and this morning, my eyes just keep watering so much and they never used to, but it could be whatever's blooming now because, I'm in Austin and this is allergy capital of the world, I think. But it's like, but but I do know the 40/60 when it comes out of the eye cup sometimes and it comes down into my cheek, it just kind of makes it according to my Seeing AI app, which Ultimates would hate, but according to it, it says that I was red under here, and I'm like, red? Why am I red? But anyway, sometimes that
Yeah,
happens.
that shouldn't last long though. That should
No,
have
no,
only lasted a
no.
couple of minutes at the most.
Yeah, yeah. And no, but I'm getting the drops in and right now I'm still leaving out the foreign eye. I'm just because it's taken me a while to get the drops in. So I'm doing um, Revitalize, See Clear, ending with 40/60, and then waiting about 30 minutes and then doing them again, and then doing that again in the evening. Is that a
Okay,
good
that's good. Yeah,
is
no,
that a good
that's
order
good.
to do them in?
Yes.
Okay.
Did
Yes. And
e-
go
excuse me,
ahead.
I got a question. Didn't you say you had gotten to the point the foreign eye was not burning you?
Correct.
Okay.
Yes.
All right. I'm sorry. Go ahead. I'm sorry.
That's okay. No, the only reason I've postponed it, I'm going to go back to it as soon as I can get faster with the eye drops. Um, right now with those 3 drops, it takes 20 to 25 minutes.
Mm.
Right.
And I don't know why it's taking so. If I could just do both eyes at the same time with the eye cups, because I do have 2 eye cups, that would make it go a whole lot faster. But sometimes if one of the cups, if I don't get it on just right and it starts to come out down the cheek,
Yeah.
need a free hand to wipe it. So I don't know.
So I would practice that though.
Yeah, that's a good idea. That
I'd
is.
practice it with just with Revitalize,
Yeah. Yeah. Until I can get it just
because
perfect.
I think the deal with the eye cup. Hang on, I'm gonna go pick mine up real quick. I'll be back momentarily.
We will wait. I'll pick on Ultimus while you're gone.
I'm fair game.
I am too.
I think the thing with the eye cup, and for those of you that can actually see me do this, is the tendency is to bring the face to the cup and then roll it back. I actually think bringing the cup just under, like at the base of the orbital bone, and then rocking it up
Okay.
gets it right where it needs to be. Okay, Altamise, that's the timer.
Okay,
I
you
want you
want
to close both your eyes before you take off the eye mask.
okay, I keep them closed during the eye mask, so they're closed.
All
And
right,
then
now
what?
take off the mask. Now, you should be able to sense light around you.
I do.
Okay, good. That is fabulous. Now, I want you to blink both your eyes open.
Okay.
Now, how do your eyes feel in this moment?
They feel good. I don't feel anything. You know,
So,
they feel good.
but you said when you were looking at the screen, it was hard for you to look at the screen.
Yeah, it's still bright, but it's bright with both of them. But
Okay.
it's not so bright that I gotta feel like I gotta close them so quick.
Okay. Okay. So here's what I'd like you to try. I'd like you to try when you're relaxing to every 15 minutes, do 5 minutes with your face mask. So for 5 minutes, block the light from your eyes.
Okay.
And then just when you open your eyes again, take the mask off, open your eyes together. And then for 15 minutes, just, be in the space you're in, but notice around how long it takes for your eyes to start to feel uncomfortable.
Uncomfortable. Okay.
So
Okay.
that means your sensitivity to the light.
Mm-hmm.
So when you start to notice that the light is bothering you,
Mm-hmm.
or that you're having any type of pain or pressure or any feeling that you can identify with.
Okay.
Okay.
Okay. When I get up in the morning, it's a full, I would say like 10 minutes before I can focus and get things where I can see them because my room it's got windows and I keep the blind, I open the blinds in the morning, but the light doesn't come in so it illuminates everything. So I have to look at everything to see what I'm seeing, if that makes any sense.
Yeah. So you're trying to concentrate on the thing as opposed to allow your sight to identify what it is.
Yeah, because when I try to have my sight identify what it is, it just see a bunch of stuff, it just see things, not
And
that I can make out what it is.
but that's how your brain is communicating with your eyes, and your eyes are communicating with your brain. And what you're trying to do is force the brain and the eyes to see the thing you know it is, even though you can't see the thing.
Yeah, I guess. Yeah.
Well, like if I have a cup in my hand.
If
If I couldn't see it well, like I'm trying to show it.
Yeah,
But
I
if I
see it.
couldn't,
Yeah.
yeah, if I couldn't actually see it well, I would try to force my eyes to see what I know it is.
Right. Absolutely. I do that all day.
Okay, and that's part of your problem
Okay.
is you're not allowing your eyes to see what to actually interact with the environment the way that they need to, and that forcing is causing pressure. That tension causes photophobia. That photophobia is sensitivity to light. So part of your issue with light is the intention to see.
Okay.
So I got to get you to calm down a little bit. And I think 5 minutes on with the mask, 15 minutes off, 5 minutes on, 15 minutes off will start that process for you
Okay.
because you don't have the ability to sit and just stare and make your eyes tired and make your brain frustrated. You got to deal with what actually is, not what you wish was. What actually is your eyes are challenged right now in sight, but you have to allow them to relearn what it is you're trying to allow them to do. They're not working functionally, and you're trying to get the functional working back in place, but you can't force it. And like I've said this to Jean probably 10,000 times in the last 6 weeks. Don't worry about what you can't see. Focus on what you can see.
Okay. To me, that means look at everything uh and just know it's there.
Yes. Have you ever gone to a museum?
Yeah.
Okay. You notice when you look at paintings, they look different depending on the distance.
Yes, yes.
Right. So that's what's going to happen with your eyes is there are some things that you need to get really close in order to identify what they are.
Right.
But if you move back even just a little bit and you give your eyes time, you just relax and don't try and force it. It'll come into a focus where you can be like, oh, okay, I see enough of that now that I can really identify what it is. Then you can move back a little bit more. But the relaxing is the seeing, the forcing, the squinting, all of that doesn't help your eyesight get any better.
Okay. Well, what I would say my forcing is to look at it longer.
Yeah,
Not squint, but I just look at it longer to make
but
sure I can see what I see.
you're not looking at it with ease. You're looking at it with intention.
Okay.
Open
Okay.
your eyes wider, squint, look away, look back, trying
No,
to,
I don't do that. I just look and I just continue to look until I see what it is. I'm sure what it is.
okay.
I don't squint and
So
I don't,
the thing I'm trying to figure out is where your eyes are getting the tension from. So, because what you're describing to me is you're feeling like a dull pain or a dull ache in your left eye,
yeah, yeah.
but it's not always there. So if you
No,
cover it,
yeah. And I would say that since I have not taken or used any of the foreign eye, it has gotten much better. So I really think it was something. Maybe it was too early for the foreign eye. I don't know, but it was an ache that came with that foreign eye. Once I continued to push it.
so today when you were outside looking at your son's car, the white
Mm-hmm.
car, and all you
Mm-hmm.
could see was white,
Mm-hmm.
and the car just drowned into the background. The question I have is, did you have any ache, any low level pain, anything like that at that time?
No, I'm not having that as it was. Like I'll say again that I think that was due to continually forcing the foreign eye. I myself think that my eye, for some reason, this left eye wasn't ready for it. And by me continually, just using it anyway and anyway and anyway, I should have backed off. And that's why I did back off this weekend, and I haven't used it. Um, so that particular ache that I was feeling when I was talking about the pain was going through to the back, that was associated with a foreign eye because
Okay, and you don't have that any other time.
no, 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 no. Like I say, it's all gone away since I haven't been using it. I don't even feel that. Now I just confused you.
No, it's not that you're confusing me. I'm thinking about the system of the eye
All right, okay.
and what's at play when you're having that experience. So to me, what's at play is a level of inflammation. But you would, in my mind, you would have the same intensity using the 40/60, if not in even increased intensity using the 40/60, because that's 40% DMSO, 60% castor oil. So
Okay.
its ability to draw inflammation out of the eye is much broader
Is
than the
much
40.
what?
The intensity of the 40/60 should be significantly more than the 4 and I. 4 and I is 20% DMSO and 45% castor oil. 40/60 is 40% DMSO,
Right,
60% castor oil. And
right.
those two are the main ingredients that are anti-inflammatory in the eye system.
Okay. Well, like I said, I was backing off. So that's why I started using 30/70 this weekend. Because once I started back, I wanted to make sure it was light. I say this weekend, but it was today.
Okay, but even I mean, 30/70 is still more intense than 4 and I. Like it just is, just based on the makeup of the ingredients.
Okay. Well,
So but I'm trying to think through it from the standpoint of
sure.
what's happening in the eye system and where there's a function that's not functioning properly. Like
Okay.
where are we getting the results that we're getting? Because it sounds to me like what your eyesight's actually feeding you is sight through severe cataract.
Well, that's what it's looking. I shouldn't say it's looking like. If I hadn't had my lens replaced, I would say that's what had happened. Um, Once you have your lens replaced after a year or more, does it go back? You need cataract? I mean, cataracts on the new
No,
lens?
no, but you can have a posterior cataract where there is a buildup of um, protein actually on the capsule where the lens lives. So the vitreous fluid is in a capsule at the
Hmm.
back of the retina, and the lens lives in that capsule. And typically, a cataract is on the lens, but you can have protein buildup on the capsule wall itself.
Okay, I hear.
So,
Okay.
what? What are you
Nothing.
thinking?
I was just thinking I was getting better. Now that sounds like going
It
the other
doesn't mean that
direction.
it doesn't mean that you're not getting better. It means better looks different than what you think it's going to look like.
Okay.
what you're looking for, I want my eyesight to get better every day, every other day, every day, and I need better and better and better and better. But what I'm trying to figure out is what's going on in the eye that isn't giving you quality eyesight.
Mm-hmm.
And
Mm-hmm.
it doesn't mean that it's not getting better as far as the eye is concerned,
Mm-hmm.
but it doesn't look that way looking out of the eye.
Right.
So if you break a bone and you go to the doctor and they set the bone and they put it in a cast, 3 weeks in, your bone's still not healed. You still can't do everything you need to do with that limb, with the broken bone, correct? But the bone is actually healing, even though there's no evidence,
Yeah.
right?
Yeah.
So
Mm-hmm.
what I want to, target is I want to be able to tell you, here's what I think is happening in the eye, and here's why you're getting the result that you're getting.
But you can't figure that right now from what I've told you. I understand.
Well, I'm kind of figuring it out. So
Okay.
I'm trying to let me read some stuff. So a posterior cataract usually refers to a posterior subcapsular cataract, a type of cataract that forms at the back posterior part of the lens, just in front of the posterior capsule. The location, back surface of the lens, posterior subcapsular area. Common symptoms are blurred vision, especially in bright light, glare and halos around lights, difficulty reading, vision worse when the pupil constricts in daylight, progression often faster than other cataract types. The cataract risk factors are aging, steroid use, diabetes, eye trauma, radiation, high myopia, inflammation, uveitis. Since PSC lies directly in the visual axis, even a small opacity can significantly reduce vision. Slit lamp examination, this is how they diagnose it. Visual acuity testing. Early stages, glasses may help slightly. Um, a definitive treatment, cataract surgery, lens removal, or intraocular lens implant. Okay,
I pray it's not that.
all right, hang on.
The only thing that just got me twisted is the fact that Friday night, go to bed, not this Friday, but the other Friday, everything's okay. I can read and see and everything. And then Saturday morning, I wake up and it's all gone. And I think that's just kind of where I'm stuck and I don't want to be.
Okay, well, hang on. So I asked ChatGPT, can this happen after cataract surgery? Yes, but not the way most people think. After cataract surgery, the natural clouding lens is removed, so a true cataract cannot come back. However, something very similar can develop called posterior capsule opacification, often called a secondary cataract. What's happening? During surgery, the thin membrane behind the lens posterior capsule is left is left in place to support the artificial lens IOL. Over time, leftover lens cells can grow over the capsule. This causes it to become cloudy, mimicking a cataract. Symptoms very similar to a posterior cataract: blurry, hazy vision, glare and halos, especially at night, trouble reading, reduced contrast. When it can happen, weeks, months, or even years after surgery.
Hmm.
The key difference is it's not a new cataract, it's a clouding of the capsule, not the lens. The treatment is a YAG laser capsulotomy. It takes a few minutes, it's painless, it creates a small opening in the cloudy capsule. Vision often improves very quickly, sometimes same day. A true posterior cataract cannot return after surgery, but posterior capsule opacification can happen and feels almost identical. That's what I think you've got going on in your eye.
And didn't you say surgery?
Well, that's how they typically treat it in the doctor's office, is with a YAG laser.
So what do I do?
I think I'm gonna put them in my backpack. So here's the deal. If you want to use the drops to try and work that out, it's going to take time and it's probably going to get a little uglier before it gets better and clearer because the castor oil and DMSO have to break down that protein on the capsule of the eye. There's two things I would do, the two things that I recommend. One, I would go to a doctor and get an absolute definitive diagnosis that that's what it is. Then you can decide, do I want to do laser or do I want to, use the castor oil and DMSO to, did I hang them up on the thing? To break this protein buildup down. Which is your preference? Because the YAG is going to be faster without a doubt.
What are the side effects of that?
Okay.
Oh, that's okay. That's okay. Don't go there because it's not that. It's not that. But I will make an appointment to go to my specialist to see what he sees in my eyes.
Okay. Why do you think it's not that?
I don't want it to be that.
Why not?
I want it to be just getting better and I don't know it.
Oh, so it's got to be what you want it to be?
Isn't that the way the world works? This is my world.
We wish, Altonese. We
We
wish it was
all
that
wish
easy.
Ultimates,
we
to
have
say
to
the least.
create our own.
Yeah, no, I locked it when I came out of it. But I had the keys. I didn't lock the keys in the car. You can't lock the keys in the car. Sorry.
Okay, so that's what I'm gonna do. I'm gonna make an appointment and go to my specialist and let him see what he sees.
Yeah,
And I'm
and
not
don't
gonna say anything, just to let him
that's
see.
a good idea. Don't feed him any information. Just let him tell you what he sees.
Okay, I'll do that. I'll probably have an appointment for next week. Okay.
Okay.
All right. Thank you.
In the meantime,
Uh-huh.
in the meantime, you want to continue to sun gaze.
Right.
Continue to use the 3070.
Okay. Do I use 3070 or 4060?
My overall preference would be to use the 4060,
Uh-huh.
but if that's going to cause any aches in the eyes, I don't want you to use that.
No, okay. I don't think it
Okay.
will. I'm gonna use the 4060. Okay. All right.
Okay. How many times a day were you using 4060?
4.
Okay. There's a piece of me that wants you to do a 6 time a day regimen with the 4060 for 3 days,
Okay.
and then do it twice a day for 2 days. And then every 3 days, you're gonna do 6 times a day. Every 2 days, you're gonna do twice a day. You know what I mean?
Okay.
And
So today I've done 4. So I can do 2 more extra. So do 6 today. And then how many would I do tomorrow?
so you would do for 3 days, you're gonna do 6 a day. And
Okay.
then 2 days, you're gonna do 2 a day. And then
Okay.
the next
3
three
and
days,
2.
you're gonna do 6 a day.
6, 3
So you're
days,
gonna do yeah,
2,
six
2
six
days.
doses for 3 days, and then 2 doses for 2 days.
Okay. And I said 4060, but today I was doing 3070. So okay, I'll start tomorrow. All right. I
Okay,
got you.
and don't swap them out. Like you pick one or the other, but don't swap them out.
Okay. 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 Stick with what one. Okay.
And I want you to do the mask thing still.
Okay.
Like when you're just hanging out,
Mm-hmm.
5 minutes mask on, 15 minutes mask off.
Okay. for like maybe 2, 3 hours,
Even just
or
an
just
hour.
any time?
Even just an hour would be fine.
Okay. All right. Good. Okay.
Okay. And
Thank you.
then I want you to come on this live every day that I'm on. So, tomorrow, Thursday,
Yeah, I
and
don't,
just
I don't miss. Look, I'm here when you're not here.
that's true. You
It's
were.
been an hour. Where is she? Okay.
That's true. So yeah, let's do that. And I just have a feeling that's what this is.
Okay.
And there's a way to solve the problem.
Okay. All right.
Okay.
I think
So
what got me is that it was kind of, I want to say it was sudden. It wasn't a gradual decrease in sight. It was just,
that happens though. And Jean,
okay.
if you're out there and available, because that happened with Jean too. And I have I wanted to say a few, but several other customers that have had the experience of going to sleep with sight and waking up with no sight.
As soon as she comes back, we're about to put the drops in.
Oh, okay. All right, Bruce, thanks.
Okay.
But Bruce, you're there. That was pretty much her experience, right? Like it was almost one day to the next. She went from I can kind of see to I can't see.
Yep. We had to just reboot, punt, figure out what we needed to do. Now we're going back in the right direction.
Right. So, and the unfortunate part of it is the breakdown of the protein using castor oil looks way more like battlefield surgery than, a planned surgery.
Uh-huh.
It looks more like emergency surgery than, a planned surgery without a doubt. So it doesn't go anywhere like what the anticipation and what the hope is. Not even the anticipation. It's just what you hope it's going to be. The cataract in my left eye, the way that cataract actually broke down was horrible.
Mm-hmm.
It was just horrible because at first it wouldn't break down and it went from looking like um this kind of dirty window to looking like someone took a damp cloth and actually smudged the dirt around even more.
Uh-huh.
And I'm like, how did it possibly get worse? Like, how could it get worse? And then I had to do some research on how castor oil actually works. And the more plaque buildup that you have, the more protein buildup that you have, the uglier the breakdown is.
Mm-hmm.
So, are you wearing your mask when you sleep?
Yes. Oh, yes. Yes.
Okay, good. Good. Keep doing that.
Did you call me Leslie?
Yes, I did. Yeah,
Okay, I'm
I was just
sorry.
talking to Altamise and we were talking about how her sight has gone from like one day it was kind of okay to the next day it's really bad. And
Hmm.
I was just saying you kind of had that same experience.
Oh, hecky yeah. Hecky yeah, man. Scary thing, isn't it? It's a scary
Yes.
thing.
Yeah.
Yeah, but here's the thing. And it's good. And I would definitely say, Altanice, if you can do an offline consult with Leslie, because I know that she could go more deep into it. But I feel 100% in totality. I know exactly what you're going through because I was like, man, I was doing 30/70 and I was having so much, you know, everything was coming back, coming back. I was like, all right. I'm like, yeah. I'm like, it's coming back, man. It's coming back. And I did it the four times a day, 30/70. Then the first month, second month, 40, dropped down to 3, then 2. And then I was like, is anybody there? Is anybody there? What's going on?
Yeah. Yeah.
Hello, what's going on?
Yeah.
Oh shucks, what's going on?
Yeah.
And I'm just gonna be real with you. I went down in my prayer closet and I prayed and I was crying and I was like, oh my God, I'm gonna have to call Leslie. And evidently she picked up on the vibe and the phone was ringing and Bruce like Leslie on the phone. And I was like, I'm not talking to her. I'm not talking to her today. I'm not gonna talk to her. That's what I said. He's like, babe, get the phone, get the phone. So
Get on the phone.
he's like, get on the phone. So I was like, I get on the phone with Leslie. And of course, she asked, how you doing? How's your site and everything? And Altonita, I went in. I was like, how's what? What are you talking about? No, this not happening. It's when something don't happen. Da 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 da. And I was telling her, and this lady right here said, "Well, good. That's awesome." I'm like, "That's awesome. How's that good?" She said, "Because now we know what we're dealing with. Now we know where to go, Gene. So now we're going to do 40/60." And she said, "I was going to call you and suggest that when I came back." She had to handle things for her mom estate. And I was like, "What? For real?" And she was like, "Yes." And then, she said, "Let me get back in town and we'll do the protocol." Here's what I learned, though. This is what I learned, and we're all in the heat of this thing right here, in the heat of the night. But I learned that you can't swap. You can't be sweeping and swapping. You can't. You got to pick one. Choose wisely. You got to pick one and get the right protocol. And you got to ride that bull till you can't ride it no more. And when Leslie said 40/60, she said, "This is how we're going to do it." Like what she said, she wanted to tell you do it 6 times in an hour, or whatever. But she's gonna figure that with you. I mean, not an hour, in a day. And
Mhm.
Right.
so basically she said, "Okay, Gene, this is what we're gonna do. You're gonna do it like you're gonna do it 7 days, 6 times a day, and then the 2 days take off, use 30/70 3 times a day." I was like, okay, okay. And so I'm just being real honest with you, as raw as I can. First couple of weeks, I was like, mm-hmm,
She's like,
mm-hmm.
Leslie's full of crap. This is not
Mm-mm.
gonna
I ain't
work.
gonna say it on. I ain't gonna say it. I was just like, okay. And I'm crying. I'm crying. I said, man, perimenopause really don't did a job on me. But I was like, this is the most emotional I've ever been in my life. And then the next week, we start seeing traction. Bruce starts seeing the cataract breaking down, breaking down. Every other day, we seeing traction. Then we start seeing thinning. Then I'm like, wait a minute, hold on. I passed by something. Did I just see that? Did I just see this? Did I just see that? Went in my backyard and I saw something run white across the backyard. I said, Daisy? And that's my dog. I said, Daisy? And sure enough, she came to me and I could see the white, her fur coming to me. I said, oh my God, are you serious? Going up the stairs, seeing the rails. Leslie had already told me to get out the house. And I was like, get out the house and do it. I think we had talked about that last week or week before. Get out the house and do what? I need to see. I need to see. I need to be able to see this and that. And she was like, don't you got Bruce? Use Bruce eyes, Jean, while your eyes are healing. And that that's been what, 2 weeks now, 2 weeks. And
Yeah.
I told her, I said, I think, like today, I said, I think my eyes is loving the damn sun because it just like taking it in. And the more that I'm out there in the sun, I come in, I'm seeing more in the house. I'm seeing more. Like did you tell her, babe, that you seeing more today? Did we? Oh,
Yeah,
we,
no, you told me earlier that your cataract's thinning even more.
yeah.
Like it was thinner this afternoon than it was this morning.
Okay, I didn't know if we told you. Yeah, it is
Yeah.
there, and I'm starting to see more things. But like Leslie said, and honestly, what you're doing with Altonese, I'm gonna tell you something. I think Leslie dead on when you go to the doctor. I think she's dead on because my son, when he was younger, when he was 9, being silly, playing with his fire truck, he was trying to fix something, and he's up in his room. I didn't even know he had got a knife, and he accidentally boom into his eye, cut it straight, and he was the youngest person in the operating room that day to have cataract surgery at 9 years old because he had developed cataract from injury. And that now he's 29. And he told me, he's in the military. He told me, Mom, they're saying that in that eye where he had injured himself, that basically he don't have a cataract, but he got something behind it and a tissue or whatever that resemble a cataract or something. And I didn't all the language that Leslie just said. I think that's what they said, and that the thing would be they would have to do surgery or something of that nature, like laser or something, and that eye.
Yeah.
And then they said his good eye, because he been using that and trying to overcompensate. They said they might have to do like a little LASIK surgery on the good eye, so he don't have to, I guess it can balance itself out. I don't know. And I was telling him, I gave him some suggestions. I wanted him to talk to Leslie, and he got a new baby becoming probably this Saturday, and just things of that nature. But I was listening to him, and I was like, well, son, you need to get in front of it now. You need to go, talk and see what can be done, not just for the one eye, but for both eyes, what can be done. Because I didn't even know you can develop something behind having cataract surgery until he told me that's what they said possibly
Yeah.
could be. And I didn't even know that existed. But I would definitely say that it is I know how you feel, most certainly, because I have even I've had my offline conversations with Leslie, and have cried and like, man, I was picking up so much traction. I was picking up so much traction, and like she said, hindsight is 2020. If I would have just kept on at this 4 times a day, maybe I would have been way ahead. But now, we're picking up traction again, and I believe we're gonna ride it to the bull, ride it to the cows come home. I really do believe that I'm on the right protocol, and I definitely believe that you're gonna get it's everything's gonna work out. It really is, and you're gonna have a powerful testimony as well.
Thank you for that, and that's what I'm gonna do. Um, Leslie, does it sound like um the running of the draining of the eye could be swelling of the macula, some kind of
No,
edema?
no,
Okay, good. Because if I
no,
go there and he says that, the first thing they want to do is that needle.
no, 100%. Yeah. And
Okay.
yeah, I'd be telling him, I'll take a needle right after you do.
Ah!
Okay, 'cause
hmm
Immediately after you can stick a needle in my eye, but no.
okay.
Yeah, no, that's what they would immediately want to do if there was macular edema. But macular edema would show up very, very differently for you. So you wouldn't have um, the calcification. You wouldn't have that white haze. Everything would just look like it would just be blurry. It would be a significant level of blurriness. Colors would just bleed into each other, but it wouldn't be that white haze over the top of your eye.
Okay. Since they said it was no reversal, I'm wondering if this is what they would call getting worse.
What do you mean?
You know, when I got my diagnosis, and he was saying macular degeneration, and he was saying, you can't restore it and it won't reverse. It would just get worse. So I'm saying I wonder if this is what they call getting worse.
So, and again, macular degeneration looks different than this, the haze. The blurriness I could totally understand for macular degeneration, but having that calcification, they call it opacification, having that in your field of sight is indicative of something is building up that's blocking your ability to see through it.
Mm. Okay.
All right, sit with that for a minute. Let me talk to some other folks.
Thank you.
Okay. Deron, are you up? How are you doing?
I'm doing okay, Leslie. I'm about 2 minutes from home. I'm gonna let get home so I can let you ask my dad some questions because he
Okay.
had a couple of questions. So I'm on. Hold on
Okay. All right. Hang
just a
on.
minute.
Nettie, how are you
Okay.
doing?
I am unmuted. Can you hear me?
You are. Yeah, I can hear you completely.
Okay, good. I still have a problem. My parcel still has not shipped.
Oh my God.
I got an email saying they printed a label and they gave me a tracking number. If I press on the tracking number, it's from UPS and they say when we receive the parcel, we'll give you a delivery date. But they have not received the parcel.
Let me see. Let me see. Let me see. It doesn't matter. I gotta go do it myself, apparently.
Yeah, this is getting on. This is getting a little bit like somebody's goofed up.
Yeah, exactly. I see. Yeah, there's no reason that it shouldn't be there.
No, because
It shouldn't be
I
shipped.
did get an email saying that I've got a label, but UPS has not received a parcel to be shipped.
Okay. Yep, no, I got that. I'm looking at it right now. Okay. I'm gonna have it shipped tomorrow without a doubt. If I gotta go fill it myself, because it's just two revitalize and two see clear.
That's right. Yeah. And it's a
Okay.
full month since I ordered now.
Yeah. And I'm gonna see if I can change out the label and do an expedited shipping so it doesn't take, 3 or 4 days, that it can get there in a couple of days, worst case scenario.
Well, I just want it shipped already. Just let
No,
it
I'm
ship.
with you 1,000%. I don't know why that label isn't getting, why your order isn't getting
Why they didn't fill it? Because
processed.
they printed the label, but they didn't fill the order.
Right. Ooh, hang on. And it's Alberta, Calgary.
That's right. Calgary,
Okay.
Alberta.
Yeah, Calgary, Alberta. I don't know why it says.
And
I will make sure this goes out to tomorrow. But on here on Shopify, I don't know why it says no customer account.
no
But
customer.
yeah, it says there's no customer account, which is weird.
Well, you
Um,
took the money out of my bank account, so I mean, yeah,
yeah, no, 100%. You have an order, but it doesn't. I'm thinking that's why it's got a
well, there is
shipping
an
label
order
on it.
number. There was an order number, yeah.
Yeah, where yeah, 11597 611597. Hang on.
And they printed a label, but the UPS just says they haven't received a package for shipping.
Yeah, it's
I
gonna
don't know
ship. It's gonna ship. I'm gonna make sure it ships tomorrow. I'll be in the office tomorrow, in the warehouse tomorrow. I'll make sure that's one of the first packages that gets filled
because
because
it's
we
been,
have those products to ship.
yeah, they should be there by now. Yeah, like last week they were promised they'd be shipped. No, I got this email saying the label was printed, but that nothing was provided.
Yeah, and usually when the label gets printed, that's when, it rolls into the packaging, process and package it and it goes on out the door. So, because last week the issue was there was no label assigned. So I made sure that got done and then I took my eyes off the ball, but I'll make sure it gets handled tomorrow.
I'm still waiting.
Unfortunately. And I took a screenshot, so I have it, and I'll look at it first thing tomorrow. Okay, I
Well,
will do that.
yeah, I hope it gets here.
It will get there without a doubt. If I got to drive it up there myself.
It's a bit of a drive, but
I
Hey,
can go
Les-
visit my best friend in Ohio for a night.
hey, Leslie.
Hey, Duran.
I am back.
Okay, great.
Got my dad here. His name is Alan. Alan
How you
Nichols.
doing, Alan?
Hello, how are you?
I'm excellent. I'm excellent. Thanks for asking.
Great.
Yeah,
So
we.
I'm here to talk about your eyes a little bit.
Go ahead.
So how have your eyes been feeling, like physically feeling in your head?
They don't no ill feeling. They just don't be seeing nothing.
Okay. But they feel okay, like they're not itchy or scratchy or painful in any way?
Right.
Okay, great.
They are a little bit red since we've been doing the drops, but other
Okay.
than that, he said they hadn't been hurting him.
Okay, good. Good. Now, have you had any change in your eyesight in the last couple of weeks?
Yes. I'm not
Tell me
able
what.
I'm not able to see anything.
So your eyesight's gotten worse.
Right.
Okay. And you're using 4-9 40/60?
No, we've been doing the revitalize one drop in the morning and the 30/70.
Okay.
And we had started doing the C clear, but he said that was we saw the redness and we stopped the C clear, so we did the revitalize, the 4-9, started that 30/70, and the Quentin
Quinton
Salem.
saying?
Uh-huh.
Okay.
Between the drops. And it's
Okay.
been once in the morning and once at night. I didn't want to do it too much to, irritate his eyes.
Okay. So we're gonna have to ramp it up.
Okay.
And so I'm gonna ask you to do twice in an hour in the
Okay.
morning, twice in an hour in the evening.
Okay.
So it's gonna be 4 drops, revitalize, 4-9 30/70.
30/70. I do have 40/60, but we went with the 30/70 first because I didn't know.
Well, if the 30/70 is not irritating him, then I would do the 30/70 in the morning, four
Okay.
and I, 30/70. Um, revitalize first, 4-9 30/70, and then in
Hmm.
the evening do revitalize 4-9 40/60.
Okay.
Yeah,
Twice each time.
twice. Yeah,
Okay.
once every 30 minutes.
Okay. All right.
And then let's see what that does the next couple of days.
Okay.
So can you come on and let me know how it's going like tomorrow and then
Yeah.
Thursday too, so we can see where things are.
Yeah.
Now, regarding the C clear, I think it's a benefit to use the C clear. I know it's giving you like a little redness in the eye. Try using the C clear and then using the Quintone after that.
Okay.
Yeah,
So revitalize 4-9, 30/70 in the morning, 40/60 in the evening.
yes.
Um, the what's after that?
So, and then at any time else in the day, whenever you can, C clear and the Quintone.
Okay. All right. Does the C clear have to be 30 minutes or do I just follow the combination and then I had been putting the C clear last.
So yeah, just use C clear when you can. You
Okay.
don't have to do it twice. You don't have to do it twice in the day. You can do
Okay.
it once a day. I just want to see if focus and clarity is something that C clear brings to the table
Okay.
after a few days, because that lutein and zeaxanthin then are very beneficial in the eye.
Okay, all right. Okay. Did you have any questions there?
No, am I gonna start seeing?
Yes, we're going to figure out what your eyes actually need, and then we're going to make sure we give it that. So what you're experiencing right now, I feel like, is your eyes are getting just enough product to actually cause a worse sight result, but the eye is a little healthier. Your sight is not getting better. So we need to do a little more to actually get any inflammation down and get your sight on the track that we want it on.
Okay. You okay with that?
Yeah,
Okay.
yeah,
So,
anything
but I do
to
remember,
help
Duran, you
me
said
see.
like a week ago that you felt like his sight was getting a little better.
Yeah, it's better on some days, and then he might take a nap and wake up and say he can't see anything. Yeah.
Okay. And does he have a sleep mask? Does Alan have a sleep mask?
No, we'll have to get him one.
Okay. Okay.
One
Yeah, I
for
recommend that without a doubt, sleeping with a sleep mask on.
okay.
But I also think increasing the regimen is
Mm-hmm.
going to, provide just more, more benefit to the eye system
Okay.
to move things along.
Got you. All right. So right now you're just seeing this real dim.
Right. I don't see, got a little glare to it. I mean, not a glare,
Haziness.
reflection. Yeah, reflection. I can see the reflection is clear, but it's look like reflection of a light.
Okay. Are you getting any more light in your eyes when you're just in the any environment? Do you feel like there's more light in the room? There's just when you go outside, it's brighter.
No, right now it's just dark.
Okay. So, Duran, can you do me a favor? Can you do a drop of 40/60 in your dad's eyes and just let him sit with it for a few minutes while we're on the live?
Sure. Uh-huh.
Am I
Okay.
have my eyes open or rolling them around closed?
Yeah, no, you're gonna get two drops, one revitalize, one 40/60. You're gonna close your eyes, roll the eyeballs around, and then fast blink and open your eyes. It's
Okay.
gonna take a couple of minutes for them to clear, but I want to see if the 40/60 makes you feel like there's a little more light in your environment, if you're seeing more light.
Okay.
Okay.
Okay?
I'll mute and do that, and we'll come back on.
Excellent. Thank
All
you.
right. Thank you.
Leslie, what it sounds like I'm hearing from everyone, the eyes must be going through like a detox period, just like if we switch our diet to a healthier diet, our liver starts to detox, everything starts to detox. Could that be what's going on? Is that the eyes are detoxing and then they flush out some of that cellular waste and then
Yes, and
you get
that and
back?
that yeah, that's a huge qualification of why the eyes go wonky to begin with,
Yeah,
is
that's what I,
because there is a waste system. Our eyes have their own waste system. And when our eyes can't get the waste, out, we wind up with all these different clogs. You have clogs in your meibomian glands. You've got open angle glaucoma. All of this trash, for all intents and purposes,
right.
is sitting in the eye system and it can't get cleaned out.
Yep.
Castor oil and DMSO have the cleaner system to make it get cleaned out. But what's causing the causation of the waste is really what we're chasing, which is the regimen is what creates the healing of the cause of that, constant deposit of waste.
Yeah. And you know, as I'm doing the drops, I'm also, this may sound horrible, I'm drinking flax oil, just a little bit every day, because the more I read about omega-3, omega-3 is critical to the membrane of the retinal cells, of all cells in the body, but especially the retina. And if the retina, if the cell membranes, the membrane around the retina cells, if it's rigid and tough, nutrition can't get in, cellular waste can't get out. But omega-3s like flax oil, it can help to, um, how can I say it, soften it, nourish it, so then the cellular waste can get out much easier. Have you read anything about all that?
Yeah, that's very true. And that one of the things that Dr. Andy says is that castor oil is very, very beneficial in making the cellular system in the eye more pliable. So he's like, if it feels like old leather or beef jerky, that's
Yes,
going to soften that material up. But a lot of that hardening is waste.
yes.
So as it softens, you're getting the waste is getting released. So it's kind of like, taking a laxative. You know, there's more stuff in there than you think. And you take a laxative and it's like, wow, that was something. But the eye doesn't have the ability to push waste away once it starts to accumulate. And that's what, castor oil and DMSO. DMSO is getting castor oil deep enough into the system. And castor oil is breaking it apart, but it doesn't break it apart a little at a time. It breaks it apart kind of wildly, just. And that's why your eyes water more, why you have more gunk on your eyes when you wake up in the morning. It's just pushing that waste completely out of the system.
That makes sense. Yeah.
So the other thing you were talking about the retinal cells, and so I've just been reading all this research on saffron. Hang on. Dude, like, why do I need to get all these notifications? So saffron has actually become one of the most interesting natural compounds studied for retinal health, especially in age-related eye conditions. But it's important to separate what's promising from what's proven. So what saffron is doing in the eye, saffron from the flower crocus sativus, contains a key active compounds that's crocin, crocetine, and saffronol. These are powerful antioxidants and neuroprotective agents, and that's where the retina connection comes in. Why the retina responds to saffron? The retina, especially the macula, is extremely vulnerable to oxidative stress, light damage, poor blood flow, and inflammation. Saffron appears to target all four. It protects photoreceptors. Studies suggest saffron helps protect rods and cones, the cells responsible for vision, from degeneration. Improves retinal function. Some clinical trials in people with early age-related macular degeneration showed improved visual acuity and better retinal sensitivity. It enhances oxygen and blood flow. So crocetine in saffron may increase oxygen diffusion and improve microcirculation in retinal tissue. This is especially relevant to to what I've been exploring about oxygen delivery to the retina.
Yeah.
And it reduces inflammation and oxidative damage. Saffron helps calm the chronic stress that contributes to macular degeneration, retinal aging, and light-induced damage. So a saffron supplement, especially if you've got macular degeneration, can be very, very beneficial, but you have to have the right supplement. Um, and then ingesting saffron, like saffron tea, is very beneficial also. It's saffron in my new product, retinal radiance, saffron is a key ingredient in that particular eye drop, along with lutein and zeaxanthin. So it has a lot of, just general benefit in the eye, and that's all of these studies have been on taking saffron as a supplement, ingesting it. And there hasn't been any real studies of saffron dropped directly in the eye or using DMSO to deposit it deeper into the macular membrane and into the fovea. So that's where my focus is specifically with the eye drop, is getting the saffron deep into the macula, deep into the fovea, is what's going to create change in that targeted visual acuity, not just general sight, but that, specific eagle eye kind of targeted sight benefit.
Right. I'll write that one down, retinal radiance, and maybe I'll add it later once I really get get
Yeah.
these other drops, going
Yeah. And
faster and so
the other
forth.
thing I want you to do is I want you to practice with, if you put the eye cup on your
Oh,
cheek and you make sure the lip of the cup
I got
is
it
at
here.
the orbital bone.
Okay. Like right
So
there.
nope, you're gonna put it just straight up and down, because what you're gonna do is cock it up
What?
to the
Like
eye.
that?
Yeah. So you want to put it down, pull the eyelid down a little bit, and you want to cock it up to the eye and then put your head back.
What? That's not going to cover the whole eye.
Yeah, well. So put the glass at the, top side, open side up. You're gonna put the glass at the base of the orbital bone.
You're seeing what I'm doing here?
Yep. Nope. So bring the glass down so that it is vertical to your face.
Yeah, like that. No, that's horizontal.
Nope.
That's
Nope. Bring it. Nope. Nope. I
do
want
it
you to
this
bring
way,
it down directly under your eye.
directly under the eye, you said?
Yep. Yeah. So
Oh,
hold the glass up like it's full and you don't want it to spill.
okay, okay.
Yes. Now, with the drop in it, you're going to just cock the glass up and then tilt your head back.
Okay, because like right now it's resting on that bone.
Yep.
And then just
Cock the glass up, tilt your head back,
yeah,
and then you can
okay,
flutter your eye.
okay. I'll try it like that.
Because I think for me, I've been playing with it and it hits right every time. Like, and
Okay.
you'll find the place
Yeah.
where, it sits
Yeah.
just right.
Yeah. Okay. I'll do
And
that
I use
after.
some distilled water, a couple of drops of distilled water, and then
Yeah.
you'll know if it when it's hitting.
Yeah. I'll practice that here after the meeting today.
Okay.
Yeah. That sounds real good. Okay.
And that way, if you get that down on
Hmm.
each side, you'll be able to double dose.
Do both. Yeah. At the same
Right.
time. That's what I want
Right.
to do. Yeah.
Exactly.
Okay. Okay.
Exactly. Because that'll come easier and easier and easier. When I was
Yeah.
playing with it, trying to figure out how can I get this drop,
Right.
if I can't waste this product, how can I get this drop in my eye every
Yeah.
time?
Yeah.
And when I started playing with it that way, instead of, trying to bring the glass up to my eye or my eye down to the glass, or,
Yeah.
place it just so, putting it right on that bone and cocking it up, it worked every single time.
Ah. Okay. I'll do that. I'll do that.
Okay.
Sometimes I think I'm getting drops into the eye cup and I didn't realize it was just all air that was coming out of the dropper. So I'm like, but I'm getting better at knowing when it's getting near the bottom of the bottle. So it's just, yeah,
Yeah.
it's
So the other thing is, um, when you use the drops, make sure your hands are clean,
yes.
but you can use the back of your nail. So if you turn your finger into the cup, oh, I get spilled. Okay. Hang on. Okay. If you put your finger on the edge of the cup into the cup, you can actually put the dropper on your nail and do a drop.
Oh, then it's going to come into my eye from the nail, not from the cup.
No, no,
Oh,
it's going to go into the cup, but
I see.
you're
Okay.
able, yeah, you're able to know what's dropped because you can
Oh,
feel it on your fingernail.
okay. So something like that, and then just drop it there on the
Yeah,
nail,
exactly. Drop it
and then it'll
on,
go.
put the dropper at your nail and then drop. When you press, you'll know if you got air or you got actual product.
That's a great idea. And then it'll just go right into the cup. It won't stay on the nail.
100%.
Yeah.
Yeah.
It'll probably,
Yeah,
well,
because
some of it will stay on the nail because it's kind of oily sometimes,
but
but
very
not
little
much.
of it.
Yeah.
Very little of it. Yeah.
Ah, that's great. That's a great idea. That's a great idea. Thank you. I'll
No,
do
you're
that.
welcome. You're welcome. Yeah. So yeah, it's I know it's more difficult when you don't have quality sight and
Yeah.
you're like, how do I make all this work so I can use it every single day, every
All
single
right.
day, every
Yeah.
single day.
Yeah.
And it feels like it can be impossible, but those simple things can really help.
Yeah.
And
It's
they
just,
helped me because I had a period of time where my eyesight
yeah.
was just atrocious.
Yeah. And that's why, gosh, you have no idea what your story means to me. Even though our eyesight issues were different, it means so much to me just to know that you were also told impossible, can't do it, can't be done.
Oh,
Yeah.
oh,
Yeah.
not, and I feel like I wasn't told. I feel like I was not even warned.
Yeah.
It was like a bellowing, like, you're gonna go blind. Are you
Right.
crazy? The only thing you can do is surgery.
Yeah.
You must be out of your mind.
Mm-hmm. Mm-hmm.
There
They,
is no natural way to remove cataracts.
yes.
All
Yeah.
right.
Yeah.
Yep. I was like, well, if I'm gonna go blind anyway, I'm gonna go out this way. Right.
Exactly.
This is how I'm gonna
Exactly.
go.
Exactly.
Go
And then
out
what
fighting.
yeah, and then what Jean was saying today, she also reversed hers, right? I mean, that's what I'm
Yeah,
gathering is that I listened to her story about how it was just, you know, no sight. And then all of a sudden, slowly that all that cellular waste just starts breaking up,
yeah,
coming out, getting it
Hmm.
just takes time. And it's like,
It takes time. It
yeah,
does. It
yeah,
takes time because that's what I wanted Altanice to know that basically, you know, yeah, we want it now. We want it
yes,
microwavable right now. You know what I'm saying? I want it right now. And, you know, like, I, it's being 4 months in, you know what I'm saying? And then, when I, did the 4, 3, 2, that third month, I'm like, oh God, what's I heard Michael Jackson, he was moonwalking. You know what I'm saying? I was like, Leslie, my eyes doing the moonwalk. What's going on? This, that, and the other. And that's what anybody that's listening out there, I did not want to do surgery. I did not want to do surgery. I have heard the horror stories.
yes,
I've heard those who've had surgery that come back and say they wish they wouldn't have never did it.
right.
One lady said she had good sight for about 30 minutes. That was from the drive from the doctor's house,
Oh,
from the doctor's office to her house. That's how long a good sight she had. And
oh,
she said it was blurry from then on. You
oh
know what I'm
gosh.
saying? And,
Yes.
I was doing my research, looking for things before we came up on Bearcat Body. And
Yeah.
the thing about it is, like she said, what I like about Leslie is that she is like a great liaison to. She does the research, she listens, and
Everything.
Yep. Yep.
everything. She hear what
Mm.
you don't think.
Oh,
She even hear.
yes.
Look, she even hear what you're saying in the undertone.
Right. Right.
Yeah.
She
Yeah.
hears it,
Yeah.
and so
Jean,
huh?
Jean, was yours just on cataracts?
Yes, yes.
Were
And
they calling them advanced or moderate or what were they calling them?
okay, here's the thing. Here you go. When I was like told about that I had cataracts like 2.5 years ago. Is it 2.5 or 3 years, Bruce? 3 years, Bruce said. And they was like, oh no, if you was my sister, I wouldn't tell you to do nothing. It's so mild. You've nothing to do. If you need us, let us know. And so fast forward, it just started boom, 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 boom. I started noticing changing my eyes, changing my eyes. I was like, okay. And last Thanksgiving, man, I was like, I noticed that things was really changing. I was like, God, please let me just enjoy my children, my grandchildren, if my sight finna go left. And I was able to see them and do all that. And then, like I said, I knew about castor oil because I was putting castor oil when it started tripping back in August. And I tell you, I say this, what had happened was, let me say, what happened was I went into perimenopause last year in the summertime, around about this time. Me and Bruce had just moved into a new home in February of last year. And at before, just eye maintenance, I was just putting castor oil on my eyelids because I heard about castor oil a long time ago that it was good for your eyes. So I was doing that, like I said, no problems. But when we moved and doing all that process from December last year to August of last year, I wasn't putting anything on my eyes. I was just busy with life, moving, babies, this, da, 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 da. And I went through perimenopause. And when I went through perimenopause, any allergy that you have, they say it gets exacerbated because of the low hormones. So I was allergic to Arm& Hammer washing powder, and I totally just moving, being so busy, being lazy. I'm gonna say that too. I didn't get my natural washing powder Ecos that I normally use, and so I just grabbed Arm& Hammer and I washed the sheets. And when I laid down, just late at night, 10 minutes laying down, my face would start itching really bad, left side. Then lay down on the right side. I didn't know what it was. We had got cleaners to come clean the house. We got the vents done. I got my dog groomed. I got everything. I was like, what's going on? But meanwhile, back at the ranch, I'm putting over the counter drops in my eyes because they were itching so bad, itching, 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 itching. And my eyes, that my allergy, everything had swollen up. And then when we discovered that what it was, I washed everything and all that went away. But I drove to Hilton Head. This is what's scary. I drove to Hilton Head with my husband, met up with one of my kids, seeing damn good, guys, seeing damn good. Drove all the way myself there, like almost 5 hours. Had a good time. Came back home and I said, Bruce, something's not right. I'm seeing a little light or light sensitivity in my right eye. The next day, I woke up and couldn't see nothing out that right eye. Uh, the left eye probably was like maybe 40-50%. I wish I would have found Leslie then. Lord, no, I wish I would have found her then.
Yeah, I know.
And I had a seminar that I had to do. People had paid thousands of dollars to come to this seminar. I said, it's too late. I can't cancel. I was like, God, please let me, I got to do this boot camp. These people don't pay this money. I got to do. So I was able to do the boot camp, and it just seemed like over time, it just started, me, no matter how much I was putting on the eyelid, it, like I said, it wasn't working. And then of course, like I prayed, like I said in December, I prayed and I asked God, like I don't apologize for my belief. I believe in God. And so I prayed and I said, you know what, if it's meant for me to do surgery, God, show me what to do. I just want to move in intelligence. I said, give me the God like mind that, whatever decision I'm making, I know how it's going to affect me, in the future. I don't want to make no stupid mistake because I'm scared and because I don't have patience. I don't have whatever. So, like I said, when I prayed, next thing you know, no lie, 30 minutes later, a video popped up because I would just put my entertainment hat became on the phone. And so I, heard Dr. Andy talk about, talking about DMSO and castor oil, the benefits of it, and how he, my husband did a research, a holistic doctor, over 30 years, all these awards he got, world renowned, I think he is, and he was talking about the magic of castor oil and DMSO, and then when he recommend, he's a Bearcat Body, Leslie
Yes.
Wright, I was
Yes.
like, who is that? And then
Right.
my husband, he looked at her, he's like, baby, that's the lady with the eyeball in the back. That's the lady with the eyeball. I'm like, what? He said, that's the
Oh
lady that
no.
we, because a couple of times I had, how you just busy and you got your phone open, you might be listening stuff, cleaning, making the bed, whatever. And a couple of times I seen her stream, but not seen her stream. I looked at it. It's like, oh, okay, she's talking about castor oil. Okay, but I didn't hear the full picture. But when he said, that's that lady with the eyeball. Okay, I went there then, and she was getting ready to get on the live, and he had ordered some product, and like I said, and it's just meant for me to say this tonight,
Yes.
so I guess I'm saying it. So
Yes.
I got started, talked to her offline, told her the whole story that I just told you guys.
Hmm.
And then she went in, it's like, okay, this is what we're going to do. The 3070 and revitalize and see clear. And like I said, my eyes was like loving the 3070. Everything was like coming back sharp. I was like, yeah, yeah, yeah. And then, like I said, when you got down to that third month and dropped down, I heard doom, 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 doom. I was
Hmm.
like, the moonwalk. I was like, what is going on? And like I said, I called and I was petrified, mortified. I was like, I don't know what's going on. You start hearing all those other voices. Did I make the right decision? Did I did gigi 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 gigi? And like I said, Leslie didn't flinch. She didn't stutter. She told me, she called me, told me, hey, look, when I come back, this is what we're gonna do. We're gonna start you on 40, 40, 60. And this is what you're going to do. You're going to do it 6 times in a day, 2 times in an hour, right? So yeah, 2 times in an hour. And she said 40, 60 still revitalize and see clear. That's what we're going to do. And she said we're going to keep doing it, and then do it 7 days straight, and then 2 days you'll do 30-70 3 times in that day, so your eyes can take a break. And then boom, you're going to do it. Then you're going to go back to the 40-60. She said we're going to keep running that protocol, Gene, till we get this stuff out of your eyes, right? And so, mind you, the cataracts that I would say, pretty much is very, very limited sight, because I try to be careful what you say, because
Yes.
I'm claiming healing. I believe in the power of the word. So my
Yes.
eyes are being fully restored and healed. But
Yes.
having challenges. And guys, I went into I went into a depression. I did. You're looking at someone, or you're talking to someone who, you know, I coach, I mentor. I have traveled all around the world, been on Good Day Atlanta, Fox News, been on, Good Morning America, worked with Danny Glover, Fran Tarkin. I could just go down some of the Real Housewives. I work with a lot of people. And to have that be stripped, I think I went into a little form of depression.
Yeah.
And basically, I didn't go outside, guys. I would go
Yeah.
outside in my backyard, but I didn't go outside.
Yeah.
I went, I was like, for what? I'm just going to let these drops do what they're going to do, but you don't know how long it's going to take. And so,
Oh my God.
what happened one day, I was talking to Leslie, she was getting an update. And I said, after I asked all my questions, like a stupid idiot, I asked her, did she have a question? Why did I do that? And why did I do that? I should have just ended the call. And she was like, yeah, are you living your life? Now, meanwhile, back at the ranch, I was cussing her out in 19 different languages. Like, what? Living your life? What are you talking about? Like, how? How I'm going to do this and that when you can barely see this, you can barely see that. And, she was like, Jean, you can't sit up there in the house. You can't sit up in there in the house. And I was like, but Leslie, I can't really see anything. I see little different things, this, that. She's like, don't you got Bruce is my husband. She said, don't you got Bruce? And I said, yes. She said, borrow his eyesight. I was like, oh God, I don't want to hear this and stuff. And so she challenged me. The next week she challenged me and she said, I just want you to, do you have a front porch? I said, well, I have a huge back patio. That's up there huge, but the front porch is very small. She said, well, can you put a chair on the pave or the front of the garage? And I said, yeah. I said, but Leslie, the day and time that we're in, I don't want nobody to see that, oh, she must be having some challenges over there. Now I become a target, you know what I'm saying? And I was like, I just don't want my neighbors knowing my business, you know, whatever. I didn't. She's like, Jean, I just want you to sit out there for 5 minutes and drink some tea and let's see how your eyes do. And so I asked her, I said, well, what about if I go to a park? Is that okay? She was like, yeah, that's really good. If you're going to go to a park, yeah, that's really good. So I don't live too far from the Silver Comic Trail. And so me and Bruce, he drove there. I'm probably having a little panic attack, you know, while we driving there, nerves scared. I'm nerves scared as hell. I'm just like, oh God, what am I doing? We get out and we lock arms and he said, babe, I'm just gonna lead the way. Just walk with me. That walk ended up being an hour that one day, the next day, an hour, the next day, 2 hours, the next day, hour and a half. Today, we went to Costco, you know, and then we end up, you know, of course we walked today and yesterday and then Leslie challenged me, I want you to go. I was like, I'm finna start taking this lady's damn phone call. She was like, I want you to go out there and go get the mail, Jean. I said, what is this lady on? Something ain't right late at night. Something ain't right. I said,
Gotta,
go get the mail.
gotta
Huh?
push yourself, huh?
Yeah, she was like, yeah, I want you to go get the mail, Jean. You can get it. You know, I want to see what it look, you know your backyard pretty easily by now. What about your front yard? Can you identify where the grass is, where the driveway? I just want you to go get them. She said, Brooks is gonna be behind you. He's gonna be behind you. He's not gonna take you this time. He's gonna be behind you. But she said to me, like I said at TLC, she said, but Jean, if you get nervous, just stop and then Bruce can get you or whatever. So I said, okay. So I did what she said. I found a clever way of how the driveway and the grass, you know, at the edge, I mean, how the edge meet that curve.
Yeah, yeah.
And I said, yeah, I can do this. And I walked all the way up to the mailbox, got the mail, came on back, and I told her, she clapped and everything. And so I've been getting the mail. But guys, let me tell you what has happened. I was like, wait a minute, hold up. I'm starting to see this image and that image, and
Yeah, yeah.
I'm out there in the sun for hours on time. And I was like, I think my eyes is loving this damn sun. Something is up. My eyes is loving this sun. And I'm starting to see more and more images. Bruce, I asked him to, you know, oil my scalp and I could see his arm coming around and grabbing stuff and picking up stuff. And I'm like, wow, okay. And starting to see different things. And I said, I called Leslie and I said, Leslie, I said, my vision is being restored and I'm
Yep,
going to see damn good.
yep,
And she said, 100%,
yep,
100%, Jean.
yep,
Like she
yep,
always said,
yep.
100%, you know. And she said, you are. And I know I am.
Yes,
I
yes,
know I am. And I know
yeah,
you guys are too.
yes,
And it was meant for me to come on today, I guess,
yes.
because it's not easy. But if we all did what was easy, nobody would have a testimony, would they? You can tell somebody, this is what I went through. This is what I'm in the fight. I'm in the fight, but I'm coming out like, you know, it's my favorite thing, like back, or, you know, I'm a movie buff, okay, you
Yeah,
know,
you are.
we all got to go to the movies. I love the movies, but one of the movies with Will Smith, when Independence Day, there you go, when the guy said that speech, we would not go gentle into the night. We will
Hmm.
not go gentle into the night. We go for the fight or whatever. And I was like, I'm not going gentle in the night. Like Leslie say, if I'm gonna go out, if this is what okay, well, I'm gonna fight, damn it.
Going out fighting.
I'm fighting. I'm fighting. I'm fighting.
Praise God, praise God.
Praise God. And a lot of times, you know, uh, things happen to us for a reason because it's not for you, it's for somebody else. Okay. Somebody else is going through this. and you're going to be able to tell your story like, yeah, I was going through this and I was going through that and I had this going on, but look, man, you see that? I'm seeing good now. I'm seeing clear now. What I do know is castor oil and DMSO works. I know that it works. I know that it works.
Thank God
And,
for
Yeah.
that.
and exactly. And the thing about it is we just got to work it. We just got to work it. And once the protocol is beautiful, once that protocol is figured out, you know, and you just don't come off of it. Don't come off of it. Don't switch. Don't do the switch and bait. Don't trick yourself and get so wrapped up that you miss a dosage. And then you try to say, oh, I'm gonna get caught up, and then now you don't miss 2 doses, and then now I'm gonna throw in a revitalizing see clear, but that ain't the whole protocol. You know what the protocol is, and so you got to stay on the protocol. You got to listen to positive personal development. You got to say your prayer. You got to do whatever. You got to speak positive word. And I have up and down. I do. I ebb and flow too with my moves. I do. And so, but I know that I'm victorious. I know that I'm victorious. And my camera isn't on for a reason, because when my camera come on, that's me signifying to every last one of you guys that I'm seeing clear. And I
Soon,
did
soon,
very, very soon. It's
soon.
happening. It's happening, guys. It's happening. And I just want to ask everybody to, be encouraged. Be encouraged. I would say the best thing you can do is book a consult, really, because there's only so much you could say on this broadcast, because you got to get everybody, questions answered and stuff. But when you book a consult, you can really just let it out, and she listens, and I bitch and moan. I do, and sometimes I cry. She listen, and but what has happened is not only um this was with my eyes is getting better, that I have created a great intimate relationship with this lady, and I respect her and honor her, and I'm very grateful that she allowed me to speak on her platform tonight, because this is for people who's watching live, but those who's watching the replay, that's
Yes.
watching this and saying to themselves, will I be able to see again? Would I be able to see clear? Would I be able, oh God, this is what the doctor said, is that it for me? And now you can ask yourself, is it for me? And if you don't believe it's it for you, it won't be it for you. It's just now you got to get a good protocol, get that protocol, follow that protocol, don't give up. And we're going to celebrate everybody on the other side.
100%.
Beautiful. Thank you. Beautiful.
One of the things that Jean asked me early on in her journey, she said, how long are you going to be available? And I
Yeah.
said, and I say this to everyone,
Yeah.
until
Thank
you
you.
get where you want to go,
Thank you.
I'm here with you.
Thank you.
Yeah.
You know, that's all there is to it.
Thank you,
Because
Leslie.
I know what it is to not have anybody to really talk about your challenges with your eyesight, the fear of what's going to happen next. What do I do? How do I do stuff?
Yeah.
All
Yeah.
of that, whether or not what your doctor says makes any sense at all. Um, it can be just as debilitating as not being able to see,
Yeah.
Yeah.
and I think that's part of what keeps us trying to hide
Mm.
is we don't have language for the lack that you feel when you can't use the thing that you're used to using all the time,
Yes.
you know? And not only can you not use it, it's because it's different being blind. When you're blind, you literally can see nothing. When you have limited sight, you can see just enough to fall down the stairs.
Yeah.
Mm-hmm.
Get anywhere else off the
Yeah.
curb.
Oh, I've
Right,
done that. Yes.
exactly. Exactly. Walk into a ladder or whatever the
A
case may
light
be. You're
pole.
seeing
Hmm.
just enough
Mm-hmm.
to make
Mm-hmm.
what was going on 5 minutes ago significantly worse.
Yes.
So, and it makes you cautious of doing simple things. I remember checking my mother in at the doctor and not being able to read the check-in sheet. The nurse just handed it to me and she goes, sign her in. And I'm like, I can't. Like, I can't read this. But it took me almost 10 minutes to admit I couldn't read it. Like, I just
Yeah.
Yeah.
couldn't read it
Couldn't see it. Yeah.
and couldn't see it. It is what it is. And I got my 86-year-old mother reading me the check-in sheet so I can fill it out and then
Yeah.
sign it.
Yep.
And it, it made me feel ridiculous.
Yeah.
But that's where I was. That's where my eyes were. It
Yeah.
it was horrible. And my mother is freaking out because she's like, "You drove us here. You can't see?"
Right. I had that
Oh, wow.
experience. Same experience. I took my mother to the doctor and I couldn't read the tiny print. So she was reading and I was filling out and it was too funny.
Yes.
Mm.
Yeah, no, it's like a Golden Girls skit with Sophia and Dorothy,
Oh my God. Bruce said,
Yeah. And we were so loud because we were talking, trying to get the understanding of everything, and people were looking. It was the funniest thing.
Yeah.
Leslie, when you talked about the saffron, I was just so excited because about 5 years ago, that was the kick I was on, saffron, but I don't think I ever found the right one.
Yeah, no, and there's two saffrons that are really highly rated.
Yeah, I
Uh
heard you last night.
Spanish saffron and Iranian saffron.
Yeah,
Yeah, I heard
yeah,
that.
yeah.
Yeah, and the saffron I have is a Spanish saffron, but I want to get the Iranian saffron and use the two and see which one gives better results in the eye.
Mm.
And when you
You know,
say in the eye, you mean putting it in your new.
yeah, putting it in the eye drop and then dropping it in the eye. Yeah,
Okay. That's
because
not going to
I
be the one with the oxygen water, is it?
yes, yes.
Okay. I'm waiting.
Yes,
Oh yeah, I am
because
too. Yeah.
one of the protocols with the saffron is it actually helps deposit more oxygen in the eye. So my
Oh, so
thought
this
process is why make it work so hard to get oxygen out of those tiny blood vessels in the eye? I'll just add the oxygen into the oxygen water with the saffron. So the saffron is actually infused into the oxygen water.
that's great. That sounds so great.
And then when you drop it in the eye with the DMSO drags all of it deeper into the eye system.
And this is the test product.
Yes.
Oh, I'm just anxious.
Yeah.
Mm.
And it's called retinal radiance.
I love it.
Retinal radiance.
Yeah.
Yeah,
Okay.
Yeah.
801.
I just feel like it's going to be a huge lift in um, macular degeneration at multiple levels. And just because the rods and cones and the photoreceptors that are in the macula and in the fovea don't get fed nearly enough um, of blood and oxygen because the vascularization is so tiny. You know,
Mm-hmm.
there's only so much it can do.
Mm-hmm.
And with DMSO, because even when I was chatting with Claude about, how I was going to formulate it and what percentages of what I needed to use, and, because that's how it helps me formulate how much of the preservative I need to use and how much of the emulsifier I need to use. And lecithin is the emulsifier, which is another great benefit to the eye system. So, but I was talking to ChatGPT about, what the goal is for me to affect in the eye. And I said I only want to talk specifically about the macula and the fovea and the neovascularization associated with those areas of the eye. And how do I get more oxygen? And how do I get more saffron deposited into those areas, but in a way that's actually calming, soothing, and beneficial to the eye with every drop? Like, it has to meet all those criteria. And, saffron deals with oxidative stress. It deals with circulation. It deals with an inflammation. So there's so many benefits for that alone, but it also has so many benefits for the rods and cones. And using the DMSO to deposit it deeper. Even Claude was like, that's kind of a brilliant strategy to use DMSO to get the benefits of the saffron deep into the eye system and be able to affect the blood flow directly because DMSO passes the blood-brain barrier. So it'll pass through um, those blood vessels and drop deposits of the curcumin into the blood, which is then going to backfeed the eye because that's where the eye gets the oxygen.
So you got
So
all the answers you needed?
I think so, yeah.
Oh,
I'm
great.
really happy
Great.
with the formulation and with all the information that I gained with, asking specific, because I asked just very specific pointed questions about each ingredient and how it participates in rebuilding the macula and the fovea.
Mm. Oh, that sounds so exciting.
Yes, it definitely does.
It was a fun conversation without a doubt, back to back. But it is the thing that I know is a little bit more about how to use DMSO and castor oil. Because when the first formulation that it gave me, it was like 2% DMSO and 4% castor oil. And I'm like, no, I need
That
30% DMSO. I need I
some
need at
things you
least
just know,
20%
huh?
castor oil.
Yeah,
Yeah, no, because I'm like, yeah, no, you're not going to cheat me out of that. And somebody needs to
yeah.
take this for the rest of their natural life. Like we need it to work. I want it to work on the front end.
Quick question,
And
and I'm sorry. Go ahead.
no, go ahead.
I was just going to ask you. I know I talked about the full body cleanse that I'm doing with York. That wouldn't
Yes,
have anything to do with my eyes backing up, would it?
it could.
Mhm.
It could because the cleanse is actually pushing more. Let's face it. If you have the best vacuum cleaner in the world, right?
Mm-hmm.
Back in the day, it was a Dyson. Not too far back in the day, but Hoover was the first like best vacuum cleaner in the world, right?
Mm-hmm. And Kirby.
Yes. So you
Mm-hmm.
got the best vacuum cleaner in the world,
Mm-hmm.
and your house is fairly clean.
Mm-hmm.
Your family comes in, they have their shoes on, whatever. You vacuum every day. Floor is fairly clean. The vacuum is brilliant. It's fantastic. You tell your cousin, I got the best vacuum cleaner in the world. Is there any chance I could borrow your vacuum cleaner? Sure. They're a hoarder.
Air it up.
Yes, they are going to take up your vacuum cleaner. I don't care how good it is because the amount of waste is above and beyond the expectation of that device,
Okay. Okay.
right?
Mm-hmm.
And that's part of the way I envision the eye system. The
Mm.
problems are not, when you look at the way a hoarder lives, the stuff is a problem. But the mental thought process that allows you to get all that stuff is the real problem,
Mm-hmm.
right?
Mm-hmm.
You can take the stuff away, but if the mindset's the same, it's just
Nope.
going to come back with new stuff.
Yeah.
And that's how I think about our eyes, especially as we age. We have to do more so the eye
Mm-hmm.
can stay really good at cleaning itself up.
Mm-hmm.
And what you're doing with Yorick's detox is you're pushing potentially more trash than the eye can handle.
Mm.
But it won't last forever, you know, because you're keeping cleaning it out. You're keeping cleaning it out. You're going to continue. And then eventually there's no excess of waste. It's just dealing with what today brought in.
So it'll be more like maintaining once you get through the rough part.
Right. Right, right. And there's always a rough part. And and I think you're in the throes of that right now, which is a hard place to be because it's
Mm-hmm.
what your body needs, but it's also the most discouraging part of the process.
Yeah.
Mm-hmm.
Yeah. Yeah. Yeah.
You know,
Yeah.
nobody ever says, "Oh my God, I lost 20 pounds of parasites today." Woo! Like,
Mm-mm-mm. Mm-mm-mm. Mm-mm-mm.
it's just not how we think of it. So I want you to embrace this part of the process and not be afraid of it.
Well, since I've been on the call a day, I feel lighter about it. I don't feel as gloomy
Good.
as I did. So I thank you all for that.
That's good.
I gotta run. I gotta run. But it's been great
Okay.
today. I'll see you. Hopefully
Um,
tomorrow I'll be back.
I'll
Leslie
be
got to
here.
run too. It's time.
Yeah. Take
Is
care.
it really?
Yes.
Almost. Yeah.
We can hang out for another hour. I
Yeah.
got energy now. What happened?
Oh
I
my
know.
gosh.
I feel good.
I do too.
No,
Yeah.
this is fantastic. It's fantastic. And I will be back tomorrow at 6 o'clock. And thank everybody for coming and hanging out. And I think Nettie already left, but I'm going to say this. Your box is going to ship tomorrow, Nettie, without a doubt. So we're going to get that done. But
Okay.
thank you
Hey there.
guys so much. Really appreciate you. Duran, how did things go with your dad's 4060?
Okay. Can you tell her how you seeing any light,
I
more
see,
light
I see plenty of light,
right now?
but it's just dark. I mean, as far as the clearness of the darkness is clear.
Okay, that's good. That's good. So the 4060 is where we need to be spending our energy, and the
Oh,
protocol I gave you is exactly what the eye is looking for.
okay. So do the 40/60 morning and night instead of the 30/70 in the morning.
Correct.
Okay. All right.
Okay.
All
And
righty.
I'm gonna check back in with you tomorrow and check back in with you Thursday, and let's see what changes come about.
Okay. Sounds
Okay.
good.
Excellent. Have a
Thanks.
great evening, everybody.
Good
Nurture yourselves
night.
naturally. Take the best
Good
Thank
care.
night.
you.
You too.
Thank you.
Bye.
Thank you.